Hello and welcome. Thank you for joining us for Ask BayCare Clinic, our Facebook Live discussion series. We're joined today by Dr. Elizabeth Congdon, optometrist with the BayCare Clinic eye specialist, to discuss pediatric eye care and children's eye health. Thanks for joining us today, Dr. Congdon.
Hi, thanks for having me.
Before we get started, I want to remind everyone that we are taking live questions today. This is your time to interact directly with Dr. Congdon. She's here to answer your questions. So if you do have questions about pediatric eye care or children's eye health, we encourage you to ask them in the comments below. We'll do our best today, as I said, to answer them in our discussion in real time. If we don't get a chance to answer your question, though, don't worry. We'll have a chance also to respond after the live broadcast as well. So let's go ahead and get started. Dr. Congdon, thanks again for being here. Let's start by talking just about children's vision in general. It might seem obvious, but how important is a child's vision to their development?
Oh my gosh, so important. So just to give a little overview, eye conditions affect about 20% or more of children. That includes amblyopia or lazy eye, strabismus, or an eye turn, or even something so simple as like a refractive error. Most children do not complain of symptoms. They rarely show obvious signs of a vision problem. I mean, you might notice it a little bit if they have like an eye turn, but undiagnosed vision problems can affect a child's development and as well as their school readiness.
Yeah, and I think that's an important thing that we're going to discuss today, because most parents will assume that if their child does have some sort of vision problem or vision error, that they would say something,
Right.
But that's not necessarily the case.
Correct.
So I think it might surprise some parents. What age do you recommend that they come in for their first eye exam?
Believe it or not, the American Optometric Association says 6 months. And I know that sounds really far-fetched for a lot of people. I don't know if I really necessarily agree with that. I think we rely really heavily on the pediatricians. I mean, really an eye exam begins when a child is in the nursery and the pediatrician comes up to check on eyes. And really the pediatricians are doing a baseline. Do things look normal? Are they behaving normally? And obviously they would make a proper referral to our office if needed. I personally think 3 or 4 years old, before a child starts 3K or 4K program to get their eyes evaluated.
Mm-hmm. Yeah, and I think that brings up a good point, because they do a lot of screenings sort of with their primary care doctors, and sometimes they'll have vision screenings in a daycare center or something along those lines. Are those an effective replacement, or what do those tell us as far as parents, what we need to know?
I mean, yes and no. The Lions Club is very involved, I think, in a lot of the Green Bay area, and they do a lot of vision screenings. They do an instrument, it's called an autorefractor, and they hold it in front of a child's vision. And it can give us like really gross ideas of what's going on in a child's vision. That being said, sometimes kids don't take it seriously and they're goofing around with their friends, and we get a lot of false positives. But by all means, it has picked up a ton of vision issues. I think they're great. I think the vision screenings are great. I don't think they truly replace a full eye exam.
Yeah, and we're going to get into those details on what that includes, but it's more than just looking for, vision problems as far as a child needing glasses. What else are you looking for when a child comes in for a pediatric eye exam?
Sure. So I would say there's like 4 main things that I'm looking for when a child comes in. The first thing we're looking for is we're testing their vision. So whether or not they can see the eye chart. Now, some kids know their letters, and that's great, and we use letters. Sometimes we use pictures. For kids that are nonverbal, or for little babies, we use flashing lights. We use toys. Are they able to fixate and follow with each eye? We include each eye, and we check always both eyes. But I mean, even we can test a child's vision that way. The next thing I'm looking for is the alignment of the eyes. So we do something called the cover and uncover test. And every time I switch from eye to eye, I'm looking for any deviation in the eye. I'm looking for any eye movement. That's something called strabismus or misalignment of the eyes. Sometimes it's very obvious and sometimes it's not. The third thing we're looking for is a prescription. So a lot of people don't know that we do dilated eye exams. So we use different dilation drops on a child than we do in an adult. A child's eye drops take 40 minutes to kick in and work, 30 to 40 minutes to kick in and work, and they can last up to 24 hours. That being said, kids handle it way better than adults. I feel like adults are like way wimpier with the eye drops. But it provides us a lot of information. So if we don't use the eye drops, what can happen is because children's eyes are way stronger than adult eyes as far as their focusing system. If we try to check a prescription without using those dilation drops, we can get very inaccurate results. So not only that, but it also opens the pupil. So we use something called a retinoscope, which is like a specialized tool with a light on the end of it. I shine the retinoscope into the child's eye, and I can use different lenses to neutralize the light coming back at me to figure out a child's prescription. So a lot of times when an adult goes to the eye doctor, they'll put their head in this machine, and it kind of gives the doctor an idea of what the prescription is. That's called an autorefractor. It's basically the same thing. I'm just doing it by hand. And also what we're looking at is the health of the back of the eye. I put something on my head called a BIO, and it allows me, I use a lens to look into the back of the eye, and I'm looking for, any congenital abnormalities. I'm looking for any possible like intrauterine infections that could have occurred, like toxoplasmosis. And it's just, I can even see like if there's like swelling in the brain or even like a brain tumor, God forbid. But it's the dilation, I always tell parents, is very, very important to give us a really thorough eye exam.
Yeah, and definitely something that they should be aware of, when they're making an appointment for their child, that this is going to happen.
Yeah, it's a little bit longer of an eye exam.
Yeah, absolutely. And I think we're going to get into a little bit more of those details. And I think you've done a good job of explaining a little bit about what that looks like. But why is that specifically important to look for those types of conditions in children?
So just again, because when children have something wrong with them, it's not obvious to us. Like I said, they don't complain of it. They might think blurry vision is normal because that's just what they've always been used to, especially if it's something that they've been born with. So it's just important to check.
Absolutely. Well, if you're just joining us, we're here today with Dr. Elizabeth Congdon. She's an optometrist with BayCare Clinic Eye Specialist. She's here today to discuss pediatric eye exams and children's eye health. As a reminder, we are taking live questions, so feel free to ask them in the comments if you have them. If you don't have questions, but you're liking the conversation, go ahead and give us a thumbs up just to let us know that you're following along. I want to get into some more specifics about the eye exam, and you touched on it just a little bit, but when people hear that you're supposed to bring in a 6-month-old baby, or even when you said 2 to 3, they're not necessarily reading, they're not necessarily verbal in some cases. So talk a little bit about what that exam looks like and what a parent can expect if they're bringing in, say, a younger child.
Sure. I have to say that our pediatrics department is so skilled. A lot of the techs and assistants are moms themselves, so, are fully aware of how the fears a children comes in when they come into the eye doctor. Playing games, just being really happy, trying to put the child at ease. And when I say like playing games, like, matching letters. If we're trying to get their vision, we're playing a matching game, or we're putting silly glasses on, or we're showing them toys, just trying to make it as fun as possible, but also get us the most information that we can.
Yeah, and you talked about that. So at what age, and I assume it progresses as children get older, so what age does the eye appointment start to look more like what maybe myself or another adult is used to?
It really depends. It depends on the child. I would say typically maybe around 7 years old, it starts to look more like an adult exam. But really it's just based on the child. Obviously, it's not going to look the same for a child with special needs at 7 as it does for a normal developing child.
Mm-hmm. So you had mentioned 6 months is recommended, maybe 3 or 4 before they start school, those types of things. Once they're in, how often do you recommend a child come in for an eye exam?
Again, based on the person, if they have something going on, sometimes we see them as often as every 3 months or every couple weeks. A normal developing child, every 1 to 2 years.
Mm-hmm. Great. So we're going to get into a little bit more about eye health in children and some of the things that are affecting children as they grow and develop and those kinds of things. Obviously, vision plays a huge role in that. I want to talk a little bit about screen time. I know that you're pretty passionate about this as well. Let's talk a little bit about screen time and its effect on our eyes, and in both adults and children, but specifically children for this conversation. This may have been even exacerbated a little bit because of the pandemic and people doing virtual learning, those kinds of things. Can an increase in screen time cause vision problems, or have you seen that in your practice?
So I get this question all the time. Parents come in, did the pandemic ruin my kid's eyes? No, it didn't. It didn't. Most certainly, the more near work you do, the more myopic you become. So that's just kind of a fact. I don't know if I've necessarily seen more myopia in my practice. But I mean, just kind of a steady influx, but that's not to say that we won't in the future see more myopia because of all the screen time that's been going on. And that's not just caused by the pandemic, right? I mean, we've seen kids on tablets and it's just kind of a new way of life now. So,
when you say myopia, can you explain for those watching what that actually means?
Nearsightedness. It's the same thing. So you can be nearsighted, you can be farsighted. Myopia actually means that you have a longer retina than normal.
Right. So then you're able to see things that are further away, but not necessarily right in front of you, maybe exacerbated by screens that are right in front of your face, that kind of thing.
Opposite. So you can't see things far away.
Great.
Yeah. Oh, okay. Sorry.
No, yeah, thank you for that clarification. So you had mentioned that you're not necessarily seeing more cases, but that doesn't mean that's not an issue. Do you have any recommendations as far as screen time for our children?
I mean, absolutely. So computer vision syndrome is a real thing. It affects aging eyes more than it affects kids' eyes. It doesn't really, research shows that computer vision syndrome doesn't really affect a child's normal eye health. That being said, I mean, tablets can affect your sleep at night. I mean, it's shown that if you use them an hour before bedtime, it's more disruptive to your sleep. They say, and let me see if I can get this right, as far as like age guidelines, 2 and under are not supposed to use any type of technology. 2 to 5 is an hour. 5 to 7, or actually I think it's like 5 to 11 is an hour and a half, and then 11 and up is 2 hours. So is the max screen time that kids are supposed to have.
Mm-hmm. Yeah, so there's definitely recommendations for a reason, I think.
Absolutely.
And for anyone wondering, that there's not one device specifically that's better than another. I mean, this is all screens that are right, in front of your face, that kind of thing, as far as recommendations.
One screen that I was thinking about that is supposed to be a little bit better is like something that is front lit. So something like, if you're familiar with like the Kindle Paperwhite, versus like a backlit, which is like a Kindle Fire or like a PC or an iPad. So the Paperwhite is supposed to be a little bit better, but there's only so much you can do on that device.
Interesting. Great. Again, if you're just joining us, we're here with Dr. Elizabeth Congdon, optometrist with BayCare Clinic Eye Specialist. She's here to discuss pediatric eye exams and children's eye health. And as a reminder, we're just taking live questions. We haven't seen any come in yet, but if you want to ask those questions in the comments, please feel free to do that as we move along through our conversation today. I want to talk a little bit about the opportunities and the collaborative care that you can offer at BayCare Clinic Eye Specialist. There's also 2 pediatric ophthalmologists when would an optometrist refer somebody to a person like that in a condition for a patient or something like that? And what does that mean for patient care at your facility?
Sure. I cannot speak more highly of Dr. Hecker and Dr. Woodward, the two ophthalmologists. I think we work as a team. I think they're just absolutely great. A big difference between an ophthalmologist and an optometrist are they perform surgery and we do not do surgery. So if there was any instance in an eye turn, or strabismus is the technical term for it, that I felt like was a surgical case, I would absolutely refer to Dr. Woodward or Dr. Heckert. I mean, it's great because even if I have a patient and I'm like, oh, I just wish, one of them could come look really quick. I mean, usually one of them is almost always there and I can just go grab and say, hey, can you jump in really quick and just give me your thoughts? And there's sometimes that we can like even forgo a second appointment because the question could get answered right then and there.
Yeah, that's fantastic. The convenience of that must be really, really important for parents as well.
Yeah, absolutely.
So we did have one question come in specifically related to juvenile arthritis and some of the conditions that can happen in your eye in that regard. Is that something that you would treat at BayCare Clinic eye specialists, and how would you work with the ophthalmologist in that regard?
So it's absolutely something that, we could all diagnose. It's probably something that I would refer to Dr. Heckert or Dr. Woodward. They absolutely manage it. They manage it all the time. It's something that sometimes involves more frequent visits. So no, absolutely can handle it at our practice.
Excellent. We do have a couple of questions coming in from our viewers now. Thank you for asking these questions. One of the questions is, and this came up too specifically related to screen time and some of the preventative measures that we all try to take and try to take steps to help alleviate some of those concerns. But would you recommend any of the blue light blocking glasses for children specifically?
No. So there is, I think it's a great marketing ploy. I think a lot of people are kind of falling for it, especially during the pandemic. Research shows that it doesn't necessarily help. What the blue light glasses do help with, so I did mention earlier that screen time before bed can interfere with your sleep. So something that has been proven is that if you wear the blue light glasses before you go to bed while using a device, you should get better sleep because again, the blue light is what interferes with our sleep patterns. So that is something that has been proven. So if that's an issue that you're dealing with, by all means, yes, the blue light glasses are for you. Other than that, I can't give the thumbs up on them. I can't tell you to go buy them.
Absolutely. I think that's very helpful. And you had mentioned just the recommendations on screen time anyway. So following those maybe first and foremost is important. Another question that came in, and this gets into sort of those recommendations maybe on a case-by-case basis for patients as well, but how frequently should a child get eye exams, or do they only get referred to a specialist if their pediatrician is concerned? So it looks like she has some maybe 4 to newborn-ish age children. So what would you recommend in that case?
So definitely get your 4-year-old in. I mean, we would absolutely do the full eye exam on him or her. As far as the 6-month-old, unless there was any, this varies from doctor to doctor, but unless the pediatrician saw any big or gross abnormalities, or if maybe something runs in your family, like a lazy eye, I might get them in. But again, we're really relying on the pediatricians. They really know what they're doing. They're looking for, gross abnormalities when you're bringing them in for their 1 week, their 6 month, their 1 year.
Mm-hmm. Yeah, and let's reiterate, just based on that conversation again, just the importance of those early eye exams, maybe for those 3-4-year-olds, so that you can catch issues early. What does that mean as far as patient care and the care you're able to provide them long-term for their vision?
Well, I mean, the sooner you can fix these abnormal problems, the better their development, the better their school. I mean, and a lot of the issues that we deal with, like amblyopia and strabismus. So amblyopia is Latin for lazy eye. That means that you're not seeing really as well as you should out of the eye, and strabismus is an eye turn. So usually the earlier you can catch that and the earlier you can treat it, the better the outcome. So, and again, usually things that can only be fixed when they are a child. So usually by age 7, if those issues are not fixed, they can often become permanent. So the earlier, the better.
Interesting. That's a great point to make too. Another question, and this is something that we've talked about in other, videos and things with eye specialists, but macular degeneration, if there's a history of that in the family, is that a condition that you would watch for in young kids, or?
It usually is not. I mean, I can't say that I've ever really seen true macular degeneration in a child. Usually develops later on in life. But definitely something to bring up to your eye care provider so that we can put it into their ocular health history. And so it will follow them forever. So it's something that should definitely be monitored later in life.
Absolutely. Thank you all for your questions. We'll continue to take those as we wrap up today's conversation. Again, if you do have questions about children's eye health or pediatric eye care, please go ahead and ask those in the comments. Dr. Congdon is here today to answer your questions. I want to get into sort of that first appointment from a parent standpoint. If I am a parent who's watching and I maybe haven't brought my child in yet, maybe they're even on the older age spectrum of children, what do you recommend as far as what I should do?
Come prepared for a long visit. Again, so the big main things that we're checking for when they come in, so this is children and adults, we're checking their entering visual acuities or how well they're reading the eye chart or able to fixate on a toy or a flashing light. We're checking the alignment of the eyes, so doing a cover and uncovered test and checking for any deviation or eye skewing. We're checking a prescription, so whether or not they're able to talk to us or not really about it. We're checking with different types of lights, and then also checking ocular health. So that means the anterior structures of the eye and the posterior structures of the eye. And of course, again, the 40-minute dilation. So.
Fantastic. And your recommendation is, of course, it's never too late, right? Just bring them in, even if you haven't done it.
Absolutely. Absolutely. Yeah. You want to fix the problem. You don't want to exacerbate it. So.
Can a person or can a patient just call your office and make an appointment? Is that something that we can do, or do we need any kind of pediatric referral or anything like that?
Just call the office, make an appointment.
Fantastic. We've covered a lot today, Dr. Congdon. It looks like we don't have any additional questions at the moment. Is there anything else that you want to add?
Just the sooner the better. I mean, we're not scary. Like I said, everyone's very seasoned with children, and yeah, it's never too late to get an eye exam.
Perfect. Well, thank you for spending some time with us today, Dr. Congdon. We really appreciate it. Thank you, everyone, for watching. Again, Dr. Elizabeth Congdon is an optometrist with BayCare Clinic Eye Specialists. To be alerted about our live content from BayCare Clinic, be sure to like us on Facebook and click on the bell icon below to subscribe. If you have additional questions, please ask them in the comments. We'll continue to answer them online after today's broadcast. And if you want to learn more about BayCare Clinic or request an appointment, visit baycare.net. Thanks so much and have a great day.